Hello, all my friends on Facebook, YouTube, all that kind of stuff. It is time for another episode of Talk Show Keeping It Real. We have an amazing guest with us today. It is Dr. Haushalter, and she is the director of the Shelby County Health Department. And we're going to be talking about an awesome topic today, the truth about COVID-19, what it means today, and Shelby County, Tennessee's response to that, and have a bunch of opportunity for questions. So feel free to comment away, and we'll see if we can't get some of those answered for you. And we're going to see you in just a minute here on Talk Show Keeping It Real.
Hey now, take a step outside and seize the day now. Set aside your worries, it's okay now. The sun is here to stay. Blue skies, feel the wind beneath you as you fly by. Dancing on a cloud, it lifts you high, high, high. Your troubles blow away. Oh, yeah.
Welcome again. Let me introduce my wonderful guest today. I got Dr. Haushalter herself. This is the director of Tennessee's Shelby County, Tennessee Health Department. And so welcome. It's such an exciting opportunity to have you on the show today and see if we can't talk a little bit about this, the COVID thing, right? That's what we've talked about a few times on the show, but now we're going to talk about it a little bit different. So what COVID is today, what that means today. Today is November 13th. And then Shelby County, Tennessee's response to that. And then we got plenty of opportunity for you guys to ask questions, put in your comments. So make sure you do that, and we'll put those right on the show. And we'll see if we can't get some answers and get us a little bit more clarity on this thing. So again, my guest is Dr. Haushalter. Well, why don't you introduce a little bit of yourself? Just talk a little bit about what you do and how you've gotten to be where you are.
Sure. And thank you for having me this evening. And I appreciate the opportunity to be here. So my background is nursing. So I have a doctorate in nursing practice from here at UT in Memphis. And my specialty is public health leadership. Spent about 40 years in public health practice. I'm originally from Pittsburgh, Pennsylvania. Then I spent a little bit over 30 years in Nashville. I'm retired from Nashville. I went into the private sector for a few years, and then in 2016, I was recruited to this position. And so I've been in the role of director since January of 2016, and I'm really happy to be here in Memphis.
Wow, gotta love Nashville. So you've been in Tennessee for quite a while now, huh?
I've been here for quite a while.
That's great. Well, then you'd be the perfect person for us to speak to today on this. And guys, a reminder, what we're going to be talking about is the truth about COVID-19 today, and get some of those amazing questions. And I've heard, I'm a pastor, so I hear it from one side. I also work with a lot of law enforcement, so I hear it from another side. And there's just so many things that are out there that are either confusing, or sometimes people think one way or another. So we're going to try to keep it real today. So we need your questions and comments. If you agree with something we said, feel free to post. If you have a question, go ahead and post that. So let's get jumping right in here real quick. So I know that, we've been in this COVID thing for a little while now, and we had some ideas and some theories at the beginning of this. And what did it start in March?
Yeah, we had our first cases early March. Mm-hmm.
Early March.
Yeah.
So we kind of come a long way since March, and we've learned some things that worked and some things that didn't work. So can you tell us a little bit where we stand today versus, how some people might think? I mean, we better, worse? Is it getting, can you tell us just a little bit about that real quick?
I think the one thing that I want people to keep in mind that's different now than March is that It's not just Shelby County or Davidson County, the two largest metros that have cases. We have cases all over the state. So it really does change the context of our response, because we can't just focus on Shelby County. We've got to think regionally and statewide. While our numbers came down fairly nicely, we have started to see a real slight trending upward again. And that indicates to us that there's pretty widespread community transmission. And our focus now is on individual and family behaviors. Probably everyone remembers when we had stay-at-home orders, when restaurants were closed, when only essential workers could go to work. We're really trying to avoid impacting businesses and having individuals make choices that are really beneficial for them. So wearing masks, not only when in public, but anytime you're around anyone who's not in your household, you should wear a mask. If you have family members who are vulnerable, like you live in a multi-generational household, then making sure you wear your mask around seniors, or if someone has a chronic illness. The other is, if you do go out into public places, and those that are most at risk are restaurants, limited service restaurants, which most people would call a bar, and gyms or workout facilities, do that in times when it's not so busy and wear your mask. Continue to social distance, limit travel, and then also to make sure over the holidays that you're making good decisions. So real heavy focus on communications and people making choices themselves.
Wow, that's great. So that's our new focus. Is that kind of nationwide, statewide, just Shelby County?
Yeah, that's a great question. And I wouldn't necessarily say it's a new focus. It's an evolving focus. So I tell people that you work a lot with law enforcement. So if you have a crime scene, it's always evolving. If you do an investigation, it's always evolving. And so a pandemic evolves. And so our response needs to evolve to reduce transmission. The goal is always reducing transmission and reducing deaths and suffering as a result of that transmission. And then using data to drive decision making. So an example is early on, we focused on masking, but we didn't put a policy in place. We realized that no matter how much we were talking about masking, we only got about 53% of the population on our surveys to actually mask. So we implemented a policy, and within a week, we went from 50% masking to 97% masking. So using that data to drive decisions really is what happens as you evolve the pandemic over time. What we do in Shelby County, we're an independent health department, but we also have a joint task force in Shelby County, which is all the municipalities are represented, all the healthcare systems, as well as some private healthcare providers, all of the school systems, and then all the support services you might think of. Early on in the pandemic, we met every day and talked about where we were in the pandemic, what was the best response, what were the supports that people needed to get through the pandemic. And then that's the way we've continued throughout. That's not how it's done across the state necessarily, and it's not done that way county to county. But the overall focus on masking, social distancing, limiting travel is what you hear from the Centers for Disease Control or from people like Dr. Fauci at the state level. So I think we're consistent with national recommendations based on our current pandemic here in Shelby County.
Wonderful, wonderful. Man, I'm taking all kinds of good notes because I hear a lot of things that sometimes connect easily with me and sometimes that don't. So I'm going to just keep you in the hot seat a little bit, just to ask you more questions. I hope that's okay.
Yeah, I'm good with that.
It's not every day we're going to get the director of the health department on our show. So we're just going to try to get all we can in. So you said limit travel, and we're going to end up, of course, having Christmas coming up, Thanksgiving coming up, that kind of thing. All right. How in the world do we handle that? My family's in Arkansas, and my parents handled Thanksgiving pretty easily. They're older, on the older side, and so they just said, we're not going to do it together. We're going to do it like, I guess, a Zoom kind of thing. I'm not sure how we're going to put this together. What do you think, and what are your family? What is your ideas of how to do that?
So we won't be getting together as we traditionally do. And my mother, who is elderly, we may drop off a plate at her house, but she will not be here. And she's actually in Nashville, and when we go there, we wear a mask for the period that we are there. And we won't be bringing. We have 5 children and 10 grandchildren. We won't have the whole bunch at one time. So we do have one child that'll come from New York. She doesn't have any children. She's going to get tested before she comes. And while she's here, nobody else will be here. So we're making a lot of adjustments to accommodate a fairly large family and reduce the likelihood of people being exposed to each other. And when possible, have people get tested if they're traveling. She will actually be quarantined when she goes back to New York because that's the policy in New York.
Wow. Okay.
Yeah. So it's not going to be our typical holiday season, and it's going to be difficult for people. But I believe we can get through it if we just all stay focused on 2021.
Absolutely. Absolutely. Well, I have a question. You said something about testing. So I hear there's a couple different theories on testing. So when I had to go get a health exam, so they checked my history, I guess that is, antibiotics or antibodies and stuff like that to see if I've ever had COVID. I'm not sure how helpful that is for me, but I guess it was a peace of mind. They said, well, we don't show that you've ever had COVID.
Right.
Okay, good. But the kind of testing you're talking about is a little different. You're talking about like the swab, is that right?
Yes. So it's actually testing for COVID, and it is a swab, but there's 2 ways it can be collected from the nose. One is very deep in the nose, which is what most people think about. And the other is what they call mid-turbinate, or at the middle of the nose, where one can swab themselves. And both of those, regardless of how it's collected, they're PCR, so they actually pick up the DNA of the virus and are able to tell you if you have COVID or not. There's some newer testing that people probably hear about called pooled testing, and that's used in people who are asymptomatic. And those are tests where you batch anywhere from 5, 10 to 20 tests at one time. And then if everyone in that specimen sample is negative, then they're negative. If one person turns out positive, then they all have to have the regular test that we just referenced, where you have to have a deeper in the nose swab and an individually run test.
So are we still in that phase where we get tested only if we have symptoms, or is it a good idea to do it ahead of time?
You can do it ahead of time. One of the things that Shelby County has done exceptionally well, we have never had shortages of testing from the very beginning.
Oh, good.
So we have underutilized capacity every day. So while people should get tested if they have any symptoms, even mild symptoms, they should get tested if they're a contact. They can get tested if they think they're at risk. So if you're going to travel, you may want to get tested before you travel. You may want to get tested when you get back, 3 to 4 days after you return. And most of our testing sites are at no cost.
Really?
So, yeah.
So we don't have to worry about the insurance and the whole thing, or?
No, if you go, some private providers, clearly they would expect insurance. But if you go to shelby.community and you see the community listed sites, an individual can call and schedule. And then it's drive-through testing, and the majority of those would be at no cost.
So that's shelby.community.com?
It's Shelby.community, www.shelby.community.
Okay.
And there should be able, people should be able to access the link for testing something.
Okay.
And make an appointment and drive through.
Oh, wow. Wow. So, I've got a plan to go on a anniversary, and I was hesitant to do it, but it's something that's inevitable. I've got to do this. So, so do you recommend that I get tested before and after this trip that we do?
Yes.
Okay. So now we're going to be on this trip. so I'm going to be a little bit more honest with you on that. So, what's the best way that we, on this little adventure that we're going to be, it's just a few-day adventure. it's going to be at a hotel. And so what is the best way? And we're going to hit at least one restaurant in the mix. So how do I do this safely? What's the best suggestion you've got for me? Now I've got some toys. Oh, let me show you my toys. So I've got face masks. Everybody knows the typical face mask. And I've got disinfecting wipes. So, you know, I'm sure that's something. Then I also got hand wipes, which is for your hands. Yeah. And then I've got gloves. So so I feel like I'm half doctor now, but without the credentials, right? So tell me what I need to do to be safe.
So a couple things. One is make a good decision about how you get there. So if you can drive and it's just you and your wife together in the vehicle, there's less likelihood of exposure. If you're going to fly, then you want to make sure that you have all of your accoutrements that you just mentioned. But I'm going to add one comment to that. The best way to wash your hands is soap and water.
Really?
Yes. And if you don't have soap and water, then the hand gel. And the third choice would be the wipes.
No way. See, I use these like crazy. I go through these. And so soap and water's first. And the reason I don't like soap and water is because in my eyes, right, I'm going to grab the handles of something that I didn't want to touch to begin with. And then I wash my hands, and then you got to get the towel and try to dry that, or use the towel to close the water off, and then use the towel to open the doors. And it's not an easy logistical concept.
Okay. So if you have difficulty with that, then use the hand gel. Because one of the things that happens when you wash your hands is the actual scrubbing and the friction gets the germs off. And you're more likely with the gel to actually get between your fingers and around your fingernails and all those places, where with the wipes, you're oftentimes likely to miss those locations.
I see. So it's not necessarily that the wipes are bad. It's just that you can't get into the nooks and crannies like you can with the gel.
Yeah, I would just say that's the third choice of the things I just listed. It's not, I'm not saying don't use it. Just know of all the options, that's not necessarily the most ideal. But if you've done all that, if you're going to go on a plane, you want to make sure as much as you can to wipe down surfaces that you're going to touch, whether it's the arm rest or the tray that comes down. You would want to wash those things off. But the key thing when you arrive there, most hotels now have fairly rigid policies to prevent the transmission of COVID. So an example is you're likely not going to have cleaning personnel come in every day. Usually come in every fifth day or every seventh day. So you have to be prepared that you're not going to have someone cleaning your room every day. You may have to go down and get your own coffee to have it ready in the morning and those kind of things. That's to reduce exposure. Most of them make you wear a mask while you're in the facility. So again, you're reducing exposure. Beyond that, it's all the same things that you would do at home. Is if you choose to go to a restaurant, try to go when it's not as busy. Make sure that there is social distancing and wear your mask. Just take it off while you're eating. And if you do that, you should be able to travel safely. Just don't let your guard down.
Gotcha. Well, thank you, because I'm glad we're talking about this subject. It's going to walk into a perfect situation for us. So is it a good idea then to use wipes to wipe down stuff like they do things ahead of time? And I heard you say that, like, grocery carts, I don't know if that's just makes us feel good or it's really doing something. I don't know if wiping down.
Doing something. It does. So think of the flu or cold. The way COVID is transmitted is the same way the cold or the flu is, but it's actually much more infectious than the flu, 2 to 3 times more than the flu.
Wow.
So if you touch in a hand cart on the grocery cart right behind somebody who may have had infection, you could pick that up. So yes, you want to wipe those things off. But the most important thing is masking, because it does contain the germs if you cough or sneeze. Singing actually really makes the germs propel far out, way beyond 6 feet, up to 18 feet. So, for example, in church, people will sing, and obviously the germs go quite a distance. People yell, those kind of things. And so washing surfaces off is good, but wearing the mask is also critical.
Okay, great. That's great. I already got some questions here, but we're going to hold off on the questions to a little further on in the show. I've got too many of my own that I want to make sure we hit first ahead of time. And then everybody who's putting in the questions in the comments, feel free to continue to do that. And we will definitely get your questions in here. Oh, okay. Well, let me go ahead and do this one because let me go ahead and show you that. So Miss Sue is asking, what about rubbing alcohol? And I'm assuming she means that instead or as a instead of the gel. I'm assuming.
Yeah, so for the gels, you want something that contains about 80% alcohol, and so if you have rubbing alcohol, it's a higher proof than that, so that can be effective. It just tends to be much more drying on your hands than the gels or the hand washes.
So it's effective. It just could dry your hands too much.
Yeah.
And so it's better to use the other gels just because they don't do as rough a job on your hands. Okay.
Another thing to think about, if you think about
Sue. Thank you, Miss Sue.
Rubbing alcohol is very liquidy. So again, it's going to run off your hands very quickly.
Yeah.
Where the gel sits there, it's designed for hand washing. And so you tend to, again, get a better wash. But rubbing alcohol also can be used to wipe off, again, the grocery cart was the example you used or other things. It can be used for that.
Wonderful. Thank you, Miss Sue. I appreciate that. And again, make sure you comment and post and make questions. We'll continue to try to put those up as we go. And for those of you just joining the show, we're with Dr. Haushalter, and so she is with the Shelby County Health Department. She's actually the director of Shelby County Health Department. So we've got one of the top leading experts right here if you have questions like that. And what we're doing on the show, Keeping It Real, is we're going to talk the truth about COVID-19. So we'll go ahead and continue here. We just got through talking about mask, and you said masks are the most important of the group of things that we can do.
Yes.
And so we're now into this discussion of what type of masks, because I've met with my friends today, and I've got some friends who were trying to tell me that the cloth ones are good or not good. The ones like I have right here, which is the official U.S. Medical Pro things, the ones that look like they belong on a surgical floor. Is that where we're supposed to be going versus the cloth versus what I'm seeing now? A lot of people have the reusable ones. And now I'm hearing that's not a good idea either. So can you give us some insights into what's a good idea? Okay.
So first and foremost, any covering, with the exception of one, which I'll name in a minute, is effective. Some are more effective than others. And depending on your role and what you're doing, that would dictate what mask you might wear. So the one mask that is not recommended, and you've probably seen them, it's a mask that has a vent on one side.
Yeah.
That actually helps spread germs. So that one you don't want to use at all. But regular cloth will help, one, prevent you from giving COVID to others, but depending on the weave of the cloth, it may not protect you as much as it's protecting others. Surgical mask, which is what you showed, protects yourself as well as others. And that's what should be worn in clinical settings. And then there's something called an N95 mask. That's a thicker mask that protects, again, you from giving it to others and vice versa. Those are generally limited to medical personnel. They could also be used by police officers or first responders. While they're very effective, they have to be specially fitted to your face. So if you don't have the proper one on, you have a false sense of security. But also they're very difficult to wear for extended periods. So for the average person, that's probably not a good choice. If someone is a physician or a nurse in an intensive care, that's what they have to wear. But I don't wear a surgical mask on general days. I wear one that's a combination of fabrics that's layered. And then, obviously only use that one day, wash it, and have another one.
So you wash it after every single day?
Yeah, I don't reuse. I have, they're silk with cotton and other layers. And so I just use it that day and wash it. And so I have many, many masks. That way I can change them out. Or if they get moist for some reason, it rained outside or whatever, I always have an extra one in a Ziploc bag that I can put on. I'm not in a hospital setting as a nurse. So if I were in a hospital setting, then I would use the surgical mask or the N95 mask.
Okay. Is there a reason we shouldn't be getting the N95s? I mean, is there a shortage still of those that you know?
Not as much of a shortage, but the key thing is they do have to be specially fitted to the face.
Oh, you mentioned that. So I've heard that
properly, it doesn't work, but also it's difficult to wear it for extended periods. So, more than a couple hours at a time, you're going to find it's very difficult to breathe through that. And then there are some individuals who find it challenging to wear a mask for different medical reasons. Like I know people who have asthma, sometimes certain masks are more difficult for them to wear all day. So I encourage people to try different ones till they get one that's comfortable for them.
Okay. So I was told that me wearing, say, an N95 would be ridiculous because I have all this prettiness around my face and then it would never seal well or something. Is that right?
That's part of the fit testing. Men with facial hair are not able to successfully wear an N95 mask. The traditional one, there's another one that's a specialty one called a duckbill. Sometimes those can be worn. So you're probably better off with the surgical mask that you have in your box.
So these are this one right here, the one I got on. Let me try to grab this thing. And is it the blue side that goes out or the white side that goes out? Is it the?
Usually blue is out.
The blue is out. So you just I'm just going to do it real quick. So you just put it on like that, and then you got to pinch right here, right, to make it seal there, and that's it, right?
That's it. Mm-hmm.
And so this is what I've been wearing almost always now. I had some of those really pretty cool ones that looked great, but I was afraid they weren't very effective because they are just novelty looking to me, but maybe they're still effective. They're still good.
They're effective, but not as effective as the surgical mask that you have. So if you have access to surgical masks, that's great. And those would be the ideal ones to use.
Yeah, thanks to my mother. She's the one that got these for me. So thank you, Mom. But so I'll keep doing that. And then interesting, I got a friend of mine who had something, and I'd love to get your take on it. So he got this new mask that's out there, right? And so what this thing does is you put charcoal filters in it, right? And it's mostly rubber plastic, and you puts it over and you turn it on, and it's blowing air at you at all the time. And it has one drawback, just the way they hooked it around the ears is not real stable. But beyond that, I was thinking, wow, is this the next generation of masks? I mean, it actually blew air at you.
Yeah, I'm not familiar with that one, and I would not necessarily recommend that.
Yeah,
I think a surgical mask is simple and that's sufficient enough. There are some masks that are called PAPRs, but again, people have to be specially fitted, and they do have forced air that comes in. So that mask that he has may be a sort of layman's version of a PAPR, but again, they have to be fitted to the face.
We'll do one more quick question before we have to cut to commercial. But what about the plastic? Because I think these are cool. See, when I have this on, the thing that drives me crazy is you don't know if I'm sticking my tongue out at you, if I'm smiling, if I'm frowning. You're like, and I don't recognize people anymore because this is all I see. And I can't always tell who people are. But there's another type of mask, the shields. And I've seen them, some go around their heads. Some are just glasses that you put on. It looks like a shield. Can you tell me, I've heard good and bad.
So the purpose of a shield is to protect your eyes. So it doesn't replace a mask. It complements a mask.
Oh, that's too bad. That was a cool idea. I could see faces again.
Yeah. So there are some people who think if they have the shield on, that's sufficient. Mm-hmm. You have to wear a mask with it. There are, again, some individuals for medical reasons that can't wear a mask, and they should wear a shield. But and that there's still some risk associated with it because all of this is open under here and things can flow into the underside of shield.
I gotcha. Well, that's kind of disappointing in a way. I like the idea of where that was going.
Yes.
I also heard something about they're pointless. Somebody was telling me about this, but pointless because it still allows germs to come in and down the
Yes.
opening or something like that. So those
But
would only be good if you seal it or something.
They're meant to protect the mucous membranes around your eyes. So
But
how we get viruses in us, if not directly from someone coughing or sneezing on us, is when we touch things and then we inadvertently touch our face. And so oftentimes the mucus membranes around your eyes are a place that the virus can enter. So the shield protects that.
Okay. So I see. So do you think a majority of this, I know they say it's airborne or whatever. Actually, let's do that after the break. We're going to talk about airborne versus touching versus how this works and why gloves might be a good thing or not a good thing. So we'll hit you right after the break. So let me start up our commercial break here. So there we go. You are watching talk show Keeping It Real, and where we always sponsor a nonprofit, and our nonprofit that we're sponsoring today for our commercial break is Saving Lost Kids. Saving Lost Kids works with missing, exploited, and sex trafficked children. They try to prevent it from happening if they can. They do rescue, search and rescue for missing kids, and sex trafficking rescue for children who got caught up in a sex traffic. And then they also do the aftercare and connecting to organizations and things like that to after the children have been recovered from that kind of trauma, of how they can get the help that they need to be restored from that. And so restoration is the other thing that they work on. They have an amazing new project that they just announced. And they have a press release out. So I'm going to go here, and you can go there as well. If you go to savinglostkids.org, savinglostkids.org. And so they've got this new project. It's called the Restoration Project. And so what they're doing, and let me try to see if I can't move it. There we go. What they're doing is they're building, let's see, what does it say? The largest long-term care facility, restoration facility in the United States for children who have been recovered from child sex trafficking. The way that works is that you can get more information about it in the press release right here. And they have a timeline that's telling you as it continues to move forward. So it looks like Sheriff Bonner is on the board. So that's a welcome for the Sheriff Bonner. We also see some other things that are there as well. When they get started, you can support the project by becoming a donor. They got 3 different ways to support the project. Become a donor. You can join one of the build teams, or you can become a connector. And if you look there, you can find those 3 ways and some more information about that as well. So that is our nonprofit shout out for today, is savinglostkids.org. An amazing and a worthy cause, obviously, to work on sex trafficking. All right, so let's get back to the show. Again, I'm Brian Callies, Pastor Brian Callies, talk show Keeping It Real. We're here with an amazing guest, Dr. Haushalter, and she is the director of the Shelby County Health Department. And we're talking about the truth about COVID. And if you have questions or comments, feel free to put them in, and we can do them live on the show, because we're always doing our show live. And even after the show, if you have some questions and comments, be sure to place them, and we can try to make sure they get forwarded to the right areas to get answered. So just before our break, Dr. H, can I call you Dr. H? Is that okay?
That's easier.
I keep fumbling on that. I can remember that. It's just House and Halter put together, but for some reason I stumble. So, Dr. H, thank you so much. So what we're talking about now on the show is we talked about masks, and we talked about the plastic masks, and then that led us to the next thing. We're talking about how we get the virus. So airborne versus touching stuff, and then how gloves fit into that equation. Can you talk to us a little bit about that?
Sure. So again, think of flu or cold.
Okay.
It's going to spread the most easily when people cough or sneeze in your face, or people who have the virus are close to you talking loudly and singing. So that's the most likely way to get it. We know that for someone to be a contact, they have to have close contact with somebody for 15 minutes or more over a 24-hour period. So if you're in a room with somebody off and on for a 24-hour period and they're coughing actively, you're going to get it from that cough. It's just going to be in the air. But also, if they cough and it's on a surface, the virus can live on surfaces for a varied amount of time, depending on the surface. In some cases, that's hours. So you can pick it up from both, but the most common way is through coughing, sneezing, singing, and things that cause the germs to come out.
I see. So gloves, you like them? Think they're important?
I think they're important if you're going to be in areas where you don't know if the surfaces are clean or not. So an example is frequently see people wearing gloves when they pump gas.
Okay.
That's a place that, a lot of people are touching that handle, and you may or may not have the opportunity to clean it, or you may or may not have the opportunity to wash your hands right afterward. And so gloves can be helpful in that circumstance. Again, if you're traveling and you're concerned about touching a lot of surfaces in an airplane or some other, like a train or whatever, then that might be another time that you'd want to wear them.
I see. Well, I used to work in a lab, so I learned a couple tricks about gloves.
Mm-hmm.
And so when I started when COVID started and people started wearing gloves, I just laughed because I saw, from my point of view, how pointless it was the way they were doing it. So I want to see if we can't educate them a little bit. So this is what I had seen. All right. So they had gloves on, started with gloves on, right? You grab your purse and you got your keys and you're going to go out and change your gas. So, we have a little hiccup here. I'm sorry about that. We had a hiccup there from the internet. So lady has gloves on, grabs her purse, grabs her keys, gets out of the car, and she's going to get gas. So she opens up her purse, gets her stuff, puts her things in. She pumps the gas. She's still holding her purse. Still pumps her gas, puts it back, puts her card back in her wallet, grabs the keys, goes back in, puts the thing down, and starts driving off with the gloves still on. Now, I looked at that. There was no purpose in those gloves at all. So can you explain to our audience of why I see it that way, or why you see it as kind of almost a pointless adventure doing it that way?
Because essentially people have put their gloves on and acted just as if they were their hands. The gloves are there for protection. They're not to be used just like you would use your hands freely, because you still have germs on the gloves. The other place that I've seen people doing that is early on in the pandemic, particularly in fast food restaurants. People would have gloves on and they would be handling money, handling debit cards or credit cards or whatever, and then touching their face. In that case, the gloves don't serve a purpose. So you're correct about that. For pumping gas, you literally only put them on when you're touching the handle, and then you take them off and throw them away after you're done touching the handle, and ideally wash your hands afterwards as well.
I see. So you put them on only when you're exposed and touching the bad stuff, the things that could be exposed, right? And then you take those off and throw them away before you touch your other good stuff, like the inside of your car or your purse. Is that right?
Face or anything. And as you well know, the gloves need to be taken off so that they're turned inside out and disposed of.
Exactly.
Now, I'll probably admit one of my concerns is we do have a lot of plastic that gets left in our environment.
Yes.
And so for gloves, it's a significant amount of gloves that keep getting thrown in the trash that ultimately go into a dump somewhere. And so I really encourage people to wash their hands and wash surfaces off. And there then might be a very few circumstances like pumping gas where they choose to wear gloves, but they don't necessarily need to wear them all the time or with every activity that they do. Hand washing is the key barrier to preventing your hands from getting germs on them.
Oh, I see. Well, wonderful. You're just so full of knowledge. Now I see why you're the director. So, got a few more questions for you. So, I've got a friend of mine who was just hoping that we could get on the show tonight, but unfortunately, he's in a bad cell area, so he's not able to get a good connection. But this friend of mine, he got the COVID. I call it the COVID. So he's got. Is it COVID-19 or is it coronavirus? Which is correct? Both.
Well, COVID-19 is a form of coronavirus, so
okay.
Use either term, will be okay.
Okay, so he got the COVID twice now. So once when we first started back in, I think April is probably, I think when he got it the first time. And then he got it again later, about a month ago. So when, and we're now in November, so he would have gotten it in October. The first time he got it, let me tell you what he told me. So he said the first time it was like a flu. It wasn't even a bad flu. It wasn't even that big of a deal. In his mind, I think he thought people were completely overreacting. It was the flu. I've heard that from so many friends, so many pastors and law enforcement friends, and that we're all just overreacting. I've heard that a lot. And well, it made sense in that sense that when he got it, it was not as bad as what he thought in his head. It was spread around to him and his wife, both, and his son got it. So, but then later, he got COVID again last month. And this time, he said that was completely different. I could feel that in my bones. It just about killed him. He had to be in the hospital. Him and his wife both had to get hospital stay. And what he told me happened is that he was released to go home, not because he was better, but because he was released with pneumonia. And pneumonia apparently is better than what he started with the COVID virus, the coronavirus at the beginning. So they felt comfortable enough to send him home, I guess. And so he goes, it was after the pneumonia that what it really happened. And he goes, he ended up getting blood clots. Mm. He felt that there was something wrong, and it was his choice. He felt like there was something wrong. So he told his wife, I think I need to go back to the hospital. So he asked for an ambulance to come and take him back to the hospital. He's basically my age. So I'm not talking about an elderly man. And so he went back to the hospital, and the doctor basically said, it's a good thing you came in when you did, because a few more hours, it's a good chance you would have died with the blood clots, so that they were able to fix. So that is radically different than the first time he got it and the second time he got it. So what I see that now as two totally different polarizing things. I got friends of mine who just scream, you can't get it twice. Well, he did. I don't know what to think about that. And the results were completely different. So do you have any insights on that for us to help us to understand what happened in that a little?
I probably don't have a lot of insight because I don't know his case specifically, but let's just talk about whether or not people can get it twice.
Okay.
The current thinking is that, yes, people can get it more than once, although that's uncommon. A coronavirus is like a cold virus, very similar, so that you can get a cold over and over again. So common sense would tell you, yes, you can get it again. But the current thinking is that generally if somebody has had COVID, they are okay for another 90 days. So an example might be if I test positive for COVID and I'm exposed to somebody else a week or a month or 2 months later, I don't have to be quarantined again. However, once 90 days passes, I do have to quarantine again. So that if there is with the risk of getting it twice, it's generally after a 90-day period. But I do think that more information will come out as more people test positive more than once. Again, that's uncommon, but it can happen. The other is whether or not someone is going to have worse symptoms the second time is not necessarily the case.
Okay.
If really each time you're infected with something, it depends on a lot of things. Your own health condition, if you're in good health or not in good health, how much of the virus you were exposed to.
How much?
Yes. It's called like the dose effect. And then the impact of that on your body. And then there is some newer data saying that the virus is mutating a little bit. And you expect that again to happen. And so it could be that a person actually has a variant of the initial strain. But there are a variety of things that play into how sick an individual may be. But all the things that you listed, pneumonia, blood clots, those are all side effects of coronavirus or outcomes of coronavirus. And then there are also individuals who seem to do well, but then somewhere around 10 to 14 days later, they appear to get very ill again and may develop pneumonia at a later time. So those are common courses, but there's a lot of variation from person to person. Some people have very mild symptoms, and they may be GI symptoms. They may not even be cold symptoms. They may have nausea or vomiting or diarrhea and still test positive for COVID. Mm-hmm.
So if you get, now we're getting just personal. I'm just asking you questions because I'm curious. Okay. So my wife and I, yesterday, I would have almost said we might have a stomach bug because we just didn't feel right. You know what I mean? But it was just a stomach thing. So, and it went away the next day. So I don't know, maybe something we ate, who knows? But even a symptom like that could be a COVID symptom?
Yes.
Really? I always thought it was respiratory. So
it is primarily respiratory, but some people will have other symptoms like GI symptoms. I use an example of one of our employees who in the middle of the day said she had a really severe migraine headache, but she didn't typically have migraine headaches. And everyone knew she didn't generally ever complain about migraine headaches. So her manager said, please go get tested. And she was positive for COVID. And the only symptom she had was like abrupt onset of a severe headache. The other thing that we know, again, by local data, so this is very specific to Shelby County, is 1 out of 5 people, so about 20% of our cases have no symptoms at all, which is what everyone's afraid of. That's what you hear about on the news is asymptomatic spreaders. But that's 1 out of 5. That means 4 out of 5 actually do have symptoms.
Okay.
And it's 80% have had symptoms locally. Of that 80%, about 50 to 55% continue to go about their activities of daily living while they are symptomatic. They go to work, they go to restaurants, they go to the gym, and we kind of ask, well, why? They minimize the symptoms. So, well, I just thought it was allergies. I just thought it was a little cold. And by the 4th day, usually they're sick enough to need to get tested. But what happens in those 3 days, they've exposed a whole bunch of people.
Wow.
Continuing. So we're really pushing to people, if you have any symptoms of illness, please stay home. Don't go to work. Don't go to the gym. Don't go to the grocery store. Get tested. There's plenty of testing available. And wait for that test result to come back, because very mild symptoms could be indicative of COVID.
Okay, let me ask you honestly, now you're a little different because of your situation, but how many times have you been tested?
I haven't been tested.
Okay, because you've never had any symptoms of it or felt like you might?
So I haven't had symptoms. I haven't been exposed to anyone that's positive.
Okay.
I very much limit my contact.
I see.
So really in our household, it's my husband and I. We're not having people come in and out. Again, we have a large family. We're used to people coming in and out. Since March, we really haven't had anyone coming in and out of the house. If we travel, it's to family, and we wear a mask when we're there, and we travel by car. Now, what we are looking at, the health department is doing some what we call assurance testing, that pool testing that I referenced earlier.
Yeah.
Do more routine testing of employees who are asymptomatic, just to get a sense of whether or not someone is positive. But personally, I've not had a need to get tested.
Okay, I got you. I haven't either. So I'm tempted. I'm wondering if maybe yesterday, since, I felt kind of funny a little bit yesterday and so did my wife, maybe we should have now that I'm hearing you talk, but I'm gonna have to, I'm gonna have to explore that. So,
Okay.
but interesting. Um, so we've, man, this has been a great conversation. Thank you. I've learned so much. I know we just keep drilling you with questions, right?
Oh, that's okay. Now, I appreciate the opportunity to be here.
Oh, that's wonderful. So, I got another friend of mine who is he is adamant that we're blowing this thing just way out of proportion. That if you're gonna get it, you're gonna get it. Right? I've heard that a lot. If you're gonna get it, you're gonna get it. We can't really do anything to stop it. Um, I'm not gonna wear any mask if I don't have to. So if it's not mandatory, I'm not gonna do it. And it's just the flu. All right. your rebuttal to his logic, if you would.
Yeah, so I think the first key is that it's not just the flu.
Okay.
It's much more infectious than the flu. As I said earlier, 2 to 3 times more infectious than the flu. But also the progression of the illness results in a higher percentage of people who would die from COVID than the typical flu. The other thing then, comparing it to the flu, is we know the flu is seasonal. So we're going to begin to have flu in the area around November. We may have flu all the way through April, early May, but the majority of flu cases are going to be in January or February. COVID is 12 months around the year. It's not seasonal. And so it continues to grow exponentially. And while we may not completely eradicate it before there's a vaccine, one of the things we want to do as a community is contain it for several reasons. One, we want to reduce the number of people who are going to die as a result of it. So those people who are high risk. We also want to make sure that we're not overwhelming the healthcare system. So if we let everyone get COVID and they fill up the hospital beds, well, if someone has a heart attack, there's not a hospital bed for them. If somebody suffers an injury from a motor vehicle crash, there's not a hospital bed for them. So we want to contain it as much as we can to reduce, again, deaths and suffering, but also to reduce the burden on the healthcare systems so we can address other healthcare issues. We know every year just with the flu alone, the hospitals get full. We know with COVID, they're filling up. And then if you think of Shelby County specifically, we're the large metro region here. So we bring patients from all the surrounding rural counties. We bring patients from Arkansas, patients from Mississippi. So our healthcare systems are really going to have the weight of all those patients from other areas who have been infected by COVID. So while we can't, again, eradicate it, we can contain it and try to reduce the impact as much as we can by simple measures such as masking.
I see. So are we in the red? And I've heard, I don't know the proof or the truth about it. Are we in the red either in Shelby County or in Tennessee? Is that, I don't know how that.
In the red. And Shelby County has gone between orange and red recently, in part because with our early measures of safer at home, I'm not going to work unless you're an essential worker, we actually slowed it down quite a bit. So while we have a very slight trend upward, the rural counties are going straight up. And so the red for the state is impacted heavily by those rural counties. And again, we're kind of going up and down between orange and red.
So from what I hear you say is in Shelby County, because of course I live in Shelby County, and I think we've been doing a pretty darn good job of. I was up in Covington, not to blame Covington. I'm just going to say there wasn't a huge risk factor in their minds at the time when I was there. So they didn't have as many of the rules that we have in place like we do in Shelby County. In Shelby County, y'all got serious. So, I mean, we have restaurants that, all right, you're at 25%. And then we have, and they're strict, seriously. And everybody had to wear masks to go into any place that I can even think of. I couldn't go to Lowe's, Home Depot, anywhere without putting masks on. And it was, I think, a very proactive approach of trying to do protection. And so I don't know that we can do how much more we'd have to mandate to do, because I think we did a darn good job of putting in a bunch of red flags and what you can do and what you can't do. In fact, the restaurant I ate at one time said, well, we can't give you silverware. You can't give us silverware? No. And so, I mean, there was a lot of things. And you can't sit here. You can only sit here. And you can only have so many people in this building at one time. And there was just a lot of rules. And so I would think, in general, Shelby County did an amazing job of being proactive, where some of the rural areas were very much more lax. I know they were, right? Because I went not a lot of different rural areas that they were just pretty relaxed. Is that what you're seeing then? Is that for Shelby County, we're going to continue, like you've been saying, we're going to continue protecting ourselves, but then the rural areas, we need to start to address that.
Yes. So one of the things I said at the very beginning of the show was the context is so much different now than it was in March, April, even in June, when we issued the mask order right before the 4th of July. So if you think of statewide, the first cases were in Shelby County and Davidson County. We announced those a day apart. So to have a very intense local approach makes sense. But once you begin to see movement into those rural communities, you have to have a statewide approach. And that includes masking statewide. Or the governor has given permission to the mayors to be able to issue mandates locally in the rural communities. And so the more that you can get a regional approach, particularly around masking, the better off will be. So even today, I have a lot of people who are like, why don't you close restaurants again?
Yeah.
Well, if we close restaurants now, people are just going to go to Mississippi, Arkansas, and Tipton County. And if they're not adhering in those counties, they're going to get exposed and come back. So that's why we're really focusing heavily on the masking. And if you travel, mask. When you're around people you don't know, wear your mask, wash your hands, because that's going to have the greatest impact currently, unless there are statewide actions that are much more rigid. I
got you. We didn't talk much about the vaccine, but in the last topic, we got a couple minutes left on the show. And again, I want to thank you for being on, Dr. H. You're amazing. Can you just give us a little bit of a hint of an insight of anything that you know about on the vaccine, like, how effective your gut is? Because I know nothing's proven, right? So when maybe is it? I don't know. I don't know if I can't put a whole lot of hope into the vaccine yet. So can you help me to?
Yeah, so what I do want the public to know is actually we're planning to distribute vaccine here locally. We have been planning for several months now, and there's some anticipated vaccine delivery into the state probably before year's end. That might be a small number of doses initially, but we do anticipate there may be some doses as early as this year. But it's not going to be available to the general public till well into next year. And people need to know that. I encourage people to stay current on what's coming out, particularly from Pfizer. Everyone heard that Pfizer's vaccine is about 90% effective. But we also don't know that it might prevent it, but we don't know if you get the COVID when you have the vaccine, if you won't be as sick. So example, again, in comparison to the flu, is we tell everybody to get a flu shot if you're over 6 months of age, because even if you get the flu, it won't be as bad. And so we don't know with the Pfizer vaccine if it'll have that same effect. So I tell people to pay attention, know that the first waves of distribution will generally be the healthcare workers, EMS, firefighters, police officers, and so on, and then last to the general public. So again, pay attention, but also plan to wear masks, social distance, and limit exposure really well into 2021, if not all of 2021.
Wonderful. Wonderful. Well, thank you so very much. We have an amazing show with you today. Again, we've had Dr. Haushalter with us today, the director of Shelby County Health Department. And we've been talking about COVID. So if you guys still have more questions, we're at the end of our show. But if you have any more questions, go ahead and put them on, and I'll try to see if I can't get her to answer those for us. But I want to just thank you all for joining us on the show. Again, talk show Keeping It Real. If you have any ideas for a great topic, feel free to comment. Facebook, you can do the messaging and that kind of stuff on YouTube as well. If you would like to become a supporter of the show, feel free. We've got some ways. If you just look down on Facebook and on YouTube, you'd see ways that you can support the show. We're going to be looking forward to changing the show up a little bit, and we're going to start going to work with DirecTV and probably going to make it something we're going to put on a national wide thing. So we're going to try to keep it nice and calm and honest like this, so that we can have these real, honest conversations. Again, thank you, Dr. H, for coming on and teaching me something, especially now that I'm gonna do a little bit of adventure, and now I feel a whole lot safer of how to handle that and how to do that. So,
well, enjoy your trip.
I appreciate you. Thanks for teaching us so much on COVID, and we will see you guys next time on Talk Show Keeping It Real.